It's Tuesday, and so we are now being joined by our In Focus health correspondent, Linord Moudou. First, Linord, you want to tell us about the discussion on the effects of coal on health, right?
That's right, Vincent. Coal is the world's largest source of energy for the production of electricity. But experts say that the production of coal creates serious health risks for miners. More than half of the electricity in the United States is generated by coal. In South Africa, over 75% of the country's primary energy needs are provided by coal. But experts say coal mining can make people sick. The advocacy group Physicians for Social Responsibility says in the United States, black lung disease has killed at least 10,000 coal miners in the last 10 years. Dr. Kristen Walker-Hood is a program director with the group.
And there's no reason to believe that the human body in Africa would act differently than the human body of an American miner. Given that, we have seen ever-increasing rates of black lung in miners in the United States, even with the controls. Now, I don't know what the occupational protection standards are in Africa, but if we're seeing rates rise here in the United States with very stringent regulations, then I think you could probably bet the same thing's happening there.
Experts say that along with the hazards of mining coal, there are risks for its use for the general population. Janice Nolan is with the American Lung Association.
Pollution from burning coal can kill. Coal-sourced air pollution can shorten lives by months to years. Burning coal produces particulate matter, both in the visible ash and soot, but even in the more dangerous and invisible aerosols that are small enough to slip past the body's natural defenses and lodge deep inside the lungs. Burning coal produces sulfur dioxide, nitrogen oxides, mercury, and other pollutants. We better appreciate now the harm that these toxins can create.
Physicians for Social Responsibility has released a report entitled Coal's Assault on Human Health. The report details how coal burning can be detrimental to human health and lead to conditions such as stroke, cancer, and heart disease. The document says coal pollutants can affect lung development and trigger asthma in children. Coal-burning power plants also emit carbon dioxide, or CO2, said to be a major contributor to global warming. Pediatrician Dr. Catherine Shee.
We know that the biggest problem with generating climate change and global warming is greenhouse gas emissions, and we know that CO2 is the largest and most important greenhouse gas. Children are going to be the first to suffer from climate change and the ill effects of global warming. They'll suffer disproportionately, and they will suffer longer than other risk groups.
To decrease the health risks associated with coal, Physicians for Social Responsibility recommends that governments make moves to cut carbon dioxide emissions as quickly as possible and focus on the development of clean, renewable energy sources.